I'm Dr. Ankita Kaushal. I'm a fertility and IVF specialist. I have been working in this field for the past decade. I work at Motherhood Hospital's Kharghar, Navi Mumbai. In today's session, we will be discussing about luteal phase support, which is a part of a lot of our treatments as far as fertility is concerned. Luteal phase is the second part of the menstrual cycle. So menstrual cycle is divided into two phases. The first phase is where the body is selecting an egg, a female egg, maturing it and driving it towards ovulation. Now luteal phase particularly begins after ovulation, and it is in this phase that the body has to provide all the hormonal support to the uterus so that the incoming embryo can be accepted, implanted and can grow into a viable pregnancy. Luteal phase support is essential in IVF because here in IVF cycles, we are manipulating the body to think that it is undergoing changes that it usually naturally undergoes before getting pregnant, while early pregnancy, till the time we see a viable pregnancy in the uterus, which is around 1.5 weeks. So we have to mimic all these changes with the help of medications, injectables or other ways that are available with us. So luteal phase is the phase where we have to provide enough support to this pregnancy that our results are positive, the results are better, and the ongoing pregnancy gets enough support during this luteal phase to sustain this early period of growth. Tailoring luteal phase support is the very important step in IVF. For example, if I have a case where there has been previous early pregnancy losses, in this case I would like to give this patient multiple ways of delivering progesterone hormone, and also I would like to add a blood thinner during the luteal phase so that the blood supply is good for the developing embryo. Now in this patient I would add an injectable as well as a local delivery system, vaginal system or an oral. If this patient has absolutely no other problem, this patient we are doing IVF for the first time but no other history, then maybe a vaginal delivery system and an oral tablet would be sufficient. An injectable might not be required. So according to the patient's history, do they have any history of repeated miscarriages? Do they have any history of repeated IVF failures? The embryos have been of good quality but sadly they have not given positive results. All this will depend on helping your clinician decide what degree of luteal phase support do you need, how much of luteal phase support do you need.